Hello, everyone. Thank you for taking the time to join us today. Microbial Insights is delighted to have Matt Burns, who's the Technical Fellow and Vice President at WSP, and he's going to be talking to us today about pathways that we might think of as minor pathways and that are often ignored, but they could have major potential for natural attenuation. So just a quick introduction. Matt is the Technical Fellow and the Contaminated Land National Service Line Vice President at WSP, and he has more than 25 years of professional chemistry and engineering experience. And Matt is just a wealth of knowledge. He's based in Boston, Massachusetts, and he brings chemical and microbial processes and diagnostic expertise to assist the local teams with challenging groundwater investigation and remediation projects in the U.S. and around the globe. Matt's a member of the Scientific Advisory Board for the International Conference on Soil, Sediment, Water, and Energy. And his areas of expertise include practical application of microbial and chemistry-based innovation remediation. And Matt has done numerous publications and platform presentations that have focused on the mobility of metals in the environment, bench and in situ microcosm testing, the use of the molecular tools. So we work very closely with Matt and compound-specific isotope analysis to assess the technical viability and to optimize the implementation of bioremediation and in situ chemical oxidation remedial strategies. And he has a saying that I truly love. It's like he likes to fail small. So he does a lot of the microcosm studies to make sure that he succeeds big when he goes to a full-scale approach. So I love working with Matt, and we're delighted to have you here, Matt. For everyone that's joining us today, please note that the webinar is being recorded, and it will be available in the resource section of the Microbial Insights website within the next few days. There's no need to email me. You're automatically going to get a link that will be emailed to everyone who registered for the webinar so that you can view this after. And at the end of the presentation today, we're going to have two sections. One is new. If you're joining us as a routine attender to our webinars, we're going to do a polling session at the end of the webinar to show attendance and to document that a little better, and then also just to get your input on a couple of ideas, and then we'll turn it over to Matt for the question and answer session. So if you have questions for Matt as he's speaking, go into your GoToWebinar control panel, input those questions, and then we'll get those answered by Matt at the end of the webinar. So without anything further, Matt, I'm going to go ahead and turn it over to you.
Well, thank you, Dora, and thank all of you for taking the time to attend the webinar. You know, MI puts on a great series of webinars and workshops, and I'm happy to be part of them. So let's start with the most important slide in the deck, thanking the team that I've been working with on the projects that will be presented. You know, without Lisa Kelly, Colleen Myers, Pam Robertson, Judy Andrews, you know, the staff that supported them, and the clients that see value in the work that we do, you know, the projects that I'm going to talk about wouldn't get off the ground. So thank you all, and please, you know, if you see them, you know, at a conference or something, let them know that, you know, that you love the work they're doing. In situ remediation has gotten really detailed, you know, over the past few years. We now know details about degradation pathways that were only black boxes, you know, just a few years ago. And there are a lot of them out there, you know, a lot of degradation pathways. You know, this screenshot alone shows many discrete degradation pathways for contaminants. You know, there are oxidative pathways, direct chemical oxidation, aerobic biooxidation, anaerobic biooxidation, cometabolic oxidation, and reductive pathways, chemical reduction, hydrogenolysis, elimination. And that's just the first part of the first page of a simple Google search for, you know, contaminant degradation pathway. All this can get a bit overwhelming, but, you know, molecular biological tools, MBTs, you know, provide information on the progress along desired pathways and warn of pitfalls such as, you know, biogeochemical dead ends. So we do have some tools out there. I think of the degradation pathways as the same as taking a trip to an unfamiliar area. You know, all of this is before GPS. So about half of you probably only know what I'm talking about here. These are triptychs on the bottom right. After every turn, back in the old days, I'd look for visual cues, right? Landscape features, signs, road signs, that indicate that I'm on the right road. Observing these cues are tests used along, the trip to my destination. If I look for these signs at key points, then the consequence of making a wrong turn would never be that significant, right? I could always just turn around, go back and get back on the right road. If I didn't look at the signs often, I could end up way off course and, maybe not even reach the destination. The degradation pathway, or pathways in the case of combined remedies, is the remediation roadmap. Specific reductants and products and number of reactants and products in the equation. Those of course vary by the contaminant being treated and the pathway being stimulated. But there's also key reactants and products to look for. Anything needed to facilitate a reaction. They're great candidates to include in performance monitoring plans. So observing expected trends is evidence of activity along targeted degradation pathway and eventually realizing your desired goals. This process is pretty well established for some degradation pathways, like sequential reduction of TCE, for example. Guidance documents for those indicators have been around for a while. I remember using Todd Wiedemeyer's M&A protocol that he drafted for the Air Force in the mid-90s. That document relied on concentration of reactants and products and intermediates. It used empirical relationships to inform on the degradation process too. For example, alkalinity increase is an indicator of bioactivity, and you got a couple points for that in the scheme. These are still applicable today. This stuff hasn't gone away, but since then, researchers have elicited many more details about the hydrogenolysis pathway that allow remediation professionals to really cut to the chase. Tools like CSIA can answer the question: has it degraded, and is it degraded? And qPCR, can just as quickly let you know the mechanism. Microbial mediated hydrogenolysis, if that mechanism is active, and even if the right genes are present to complete the degradation to end products. I use MBTs all the time to basically cut to the chase, to make sure that I'm on the degradation pathway I want to be on. And I use them even before I have a contemplated remedy or trying to implement the remedy. It helps me let me know what the right map is. Find the right map. It's not always that you know where you're going. So here's what I mean by that. This flow chart shows the steps for managing any project or any problem. From grocery shopping to complex remediation sites. I know this chart is right. I got it off the internet, Wikipedia. They're never wrong. So after initiation, all projects go through a planning stage, a performance stage, and a testing phase. If the test is passed, then the project closes. But if the test fails, then basically you need to start over. In remediation, if you mismatch the pathways to the set of conditions at the site, this can become an endless cycle, characterized by seemingly never-ending routine quarterly sampling. High costs and upset clients are indicative of this also. So the way to break this cycle is to make sure that the nature and extent of contamination are understood, and that any degradation pathway, natural or stimulated, that you're counting on is active at that site and is complete at that site. If a problem is identified early and at small scale, you'll be able to adjust. And that adjustment may give, it might even be, if you get bad news, you have to abandon a contemplated remedy. No one likes to be wrong about a plan, but it beats the iterative rounds of sampling that happen if you don't identify that you're wrong early on. I've been calling this, as Dora mentioned earlier, fail small and succeed big, it sounds a lot better than, screw up prevention. So for the balance of this webinar, I'm going to talk about a newly applicable, more newly available. It's actually an old diagnostic, but more recently put back into use for some minor degradation pathways. Minor might not be the right word to describe these pathways, maybe lesser known or lesser applied. Anyhow, I'm going to presenting case studies on MNA, so not mononatural attenuation, for trichloroethene and 1,4-dioxane along some of these lesser known degradation pathways. Both of these compounds can be degraded aerobically by aerobic co-metabolism. Co-metabolism has been around for a while as an engineered remedy. I remember used when I first started in the early 90s. To treat TCE. It's still used today for other compounds too, including 1,4-D. This process is aerobic and relies on a primary metabolite that microbes use for growth. As the microbes are taking advantage of that metabolite, they produce enzymes that degrade that primary metabolite, but fortuitously degrade the TCE or 1,4-D. And other compounds are organic compounds can readily be oxidized too. It's just, they just happen to be in the area, they get oxidized by these enzymes. I'm also going to be discussing abiotic natural attenuation of TCE along the elimination pathway. The elimination pathway is the predominant TCE degradation mechanism with zero valent iron. So a lot of you are probably familiar with that one as well. Naturally occurring ferrous ions, ferrous iron minerals like macoanite and even oxy-tolerant minerals like magnetite can stimulate degradation along the elimination pathway for a natural attenuation remedy. The first case study is the oldest in the group. We did the analytical for this one back in 2018, and continued through 19, and we're in a good spot right now, as I'll explain. This is the furthest of the furthest along the implementation path of the case studies I'll be presenting. Here's the summary. It's a recently identified site. Only a couple of rounds of sampling data had been collected before we first got here. It's a large dilute plume with a maximum TC concentration of about 100 ppb. It's an oxic sandy aquifer, no daughters, just TCE, present in the groundwater. And there's an area downgradient to be protected that needs to be protected. It's some agricultural production wells. So there's approximately 500,000 cubic meters of affected aquifer here, or cubic yards, excuse me. So we took a look at ISCO and went so far to run a bench test in that fail small, succeed big mode. It turned out to be a very low demand site, but still was going to cost a fortune to implement. 500,000 cubic yards at any price per cubic yard adds up quickly. But what really killed this alternative wasn't the cost. It was that the bench test revealed that we mobilized quite a bit of hexavalent chrome, and we did not want to end up cleaning up hexavalent chrome after we cleaned up the TCE. So we had another idea. Based on the plume distribution, there appeared to be some natural attenuation going on, but there's no reductive daughter products, so it's not along the hydrogenolysis pathway. As I mentioned earlier, abiotic degradation by oxy-tolerant ferrous minerals or co-metabolism could account for this type of attenuation. The typical approach to quantified degradation of things that are a little bit outside of the norm would be to that you couldn't directly quantify, would be to use site data like aquifer characteristics and temporal concentration data, plug all that into a model and calibrate that model and derive a rate. But we've only had at this site we only had a couple rounds of concentration data. not enough to derive a rate, but not even close. And if the appropriateness of just pulling a rate from literature would be questionable. I mean, it's questionable even when you do it for hydrogenolysis pathway. I mean, huge range, orders of magnitude range and potential degradation rates are present in literature. But it would be even more difficult to defend given the the non-hydrogenolysis pathway that we think is occurring here. So backing into a rate just wasn't an option at this site. So I turned to a molecular biological tool, one that I found out about at the Patel conference in Miami. I think it was 4 years ago. And it is based on work out of Dr. David Friedman's lab at Clemson and the diagnostics offered by Microbial Insights. Dr. Friedman has developed a 14C assay to quantify the rate of TCE degradation along abiotic and cometabolic pathways. Basically, the assay involves spiking 14C TCE into serum bottles containing site soil and groundwater for the abiotic and just groundwater for the cometabolic. Now, should point out that 14C is not a stable isotope that we might be familiar with from other MI webinars. Those use C12, C13. C14 is a radioisotope. This probably be familiar with that with carbon dating. But in this case, what Dr. Friedman is doing is making up TCE, or he has TCE made up that has C14 as the carbon. That radioactivity of that C14 TCE allows for very low detection limits over a 6-week period. That's the duration he runs these tests at. And monitoring small changes in the accumulation of carbon dioxide can easily be measured with such a sensitive technique as using the radiation. He uses a liquid scintillation technique. Controls are also incorporated into the test that Dr. Friedman runs. One of the more important controls that I'll mention as we go through this, I want to make sure you understand it, is there is an effect of TCE degradation. TCE gets degrade caused by radiation. So as the radioisotope decays, it releases energy that ends up forming radicals, like hydroxy radicals, that can in turn oxidize TCE and also form some carbon dioxide. So obviously we're not interested in quantifying carbon dioxide that comes from something we added to the test. So Dr. Friedman uses this information from his control to adjust the results of the site media trials, site groundwater and soil, so that he can account for this. There's a slide coming up that provides some references and more information on the 14C assays and Dr. Friedman's work. This slide present some detail on the suite of analysis used to assess the abiotic pathway at this site. In addition to the C14 assays, MI estimated the amount of ferrous iron minerals present by magnetic susceptibility analysis. The magnetic susceptibility data was compared to the data from other sites where the relationship between magnetic susceptibility and the rate of TCE degradation had been established. For the co-metabolic assessment, the C14 assays were used, and the presence of co-metabolic oxygenase genes was also assessed. All right, so I know I just glossed over the C14 assays a bit, so here's a slide of reading materials on the C14 assays. These are all co-authored by Dr. Friedman. I highly recommend that you cut to the chase and hit the last one up there. It's a webinar he did for Microbial Insights in December of 2018. So go to the Microbial Insights website on webinars and you can listen to that one anytime you like. And the other one that is probably most pertinent to this one is the second to last, the Mills work here. This one discusses, and this is a product of that first Battelle conference that I went to and learned about this, was Mills presented this information at that conference, and I learned about it. So that's also a very nice publication. And there's many others, so have at it. Dr. Friedman does great work and has been for a very long time. Well, here are the results. TC degradation was quantified in one of the 4 samples in both the co-metabolic and abiotic assays. Not great, but better than not being quantified in any of them. And if you squint a little bit and divide by 4 the abiotic assay, you can get a rate of 0.04 per year. That's a little bit of squinting, but without squinting, the magnetic susceptibility data down the bottom of the slide, that's the most consistent that we found. Everything was around 2e to the -7 meters cubed per kilogram. So let's compare the magnetic susceptibility results to literature values. This is data from BioPic. This is the ESTCP project. It resulted in a great tool. The final report contains lots of pertinent information, and I encourage everyone to take a look at this. It's really good, and it's a great little cheat sheet if you're looking for some information on some of these degradation pathways that I've discussed. There's great definitions of those inside here. And this is also another Air Force deal. If you're looking for other webinars to check out, ESTCP, they do some great projects. MI has been involved in some of them. They're very practical. They're not very researchy at all. Everything has a practical end goal. So I encourage people to check out that website as well. All right. So you can see from the site data, it plots similarly to the data from Hopewell. I'm glad Hopewell was included in the study, because that's on the lower end of the scale of susceptibility that they measured in the study. The degradation of Hopewell is around 0.06 per year, which is very close to the 0.04 per year that we got by taking those C14 data, squinting a little bit, and dividing by 4. So the rates that we estimated from this study, or the 2 rates, are pretty consistent. They align. So we plug site data, including all the aquifer characteristics, and into the rate of 0.04 per year into REMChlor. And when I say we, I mean the Colleen Myers up in the front there. I wouldn't know what to do with it. We had no issues with the model calibration after she plugged in all the data. And the predictive simulation showed that the plume would not extend beyond the boundary of the already impacted property at a concentration greater than the target, 5 milligrams per liter. So this is just within the goal of preventing the migration beyond the restricted property. A model prediction isn't the end all here. What counts is what happens in the field. So the next steps involve quarterly monitoring to validate this model. Make sure that what we predicted in the model actually happens in the field. And if we are able to validate it, we'll get regulatory closure. Now for the cost and performance assessment. 500,000 plus cubic yards of affected aquifer times any costs to remediate that actively. You put in whatever dollar number you want to there per cubic yard, and it comes out to a big number. On the other hand, the advanced diagnostics cost $10,621.57. That's a fairly small percent of the active remediation costs. The entire cost of closure, if the model is validated, ends up at around $200,000. So this project's definitely tracking towards the win big side of the fail small, succeed big proposition. The second site is a case study that was performed with identical analytical to the other site, the previous site. This time, this site was in the southeast. The other one was more central U.S. Unlike the previous site, this one had been studied a lot more. The studies actually, these C14 assays that we just did have recently been completed, and we're going through the data now. But here's a little bit of background, and we'll tell you what we're thinking. There's a TCE and cis DCE are at about 1,000 micrograms per liter max concentration. That's TCE, and there's much less DCE, but there's still some. It has affected a large volume like the previous site. Unlike the last site, there is a lot of time series concentration data available. And that data has shown the plume to be shrinking in size and decreasing in concentration. There is no accumulation of vinyl chloride or ethene at this site either. And this is probably because it's not a very hospitable environment for D. helicoides. The pH is low, and there is some dissolved oxygen present. Another notable characteristic of this site was that biotite was identified in the saturated zone. Biotite is one of those ferrous iron minerals that could potentially naturally stimulate abiotic reduction of TCE. CSIA data that's been collected at this site is consistent with natural attenuation. The graph on the right shows a plot of both TCE and DCE isotopic signatures. The gray area to the left is the range of isotopic signatures of manufactured non-degraded TCE. You can see there aren't very many points over in that area. As far as the mechanism, there could be some sequential reduction going on here, hydrogenolysis, or could have been, I don't know if it's active, hydrogenolysis of TCE to DCE, by other microbes other than DHC that might be a little bit more tolerant to those conditions. But at this site, the DCE is also fractionated. It is degrading, and we don't see accumulation of vinyl chloride or ethene. So, something else is going on here. There are other pathways involved. And abiotic and cometabolic natural attenuation pathways could explain this. And here are the results. The cometabolism assays were a wash. No statistically significant degradation. But the abiotic study identified 2 of the samples with significant rates of degradation. Like the previous study, we plan to use a model to predict the fate of the plume. But unlike the last site, there's a good amount of historical data to provide a basis for calibrating the model and deriving a rate. So in this case, the C14 rate information provides bracketing information to improve the calibration and make the model better. The final 2 sites are grouped together because they're very similar. Trichloroethene released is so the first site, trichloroethene, actually at both sites, trichloroethane releases also included 1,4-D, which travels at nearly at the speed of groundwater. So it's out in front of the chlorinated solvent plume, because the chlorinated solvents usually interact with aquifer sediments a little bit more in comparison to the 1,4-D. So both plumes are large and dilute. The concentrations of 1,4-D are also not high enough to indicate that direct oxidation by microbes used to sustain growth is going to happen, and not possible, not even close to being possible. But the naturally occurring cometabolism could be viable. But we had no indication that that was actually occurring at either of these sites, by the shape of the plume or time series data. So the 14C assays in these cases were really false, fail small to succeed big gamble. But again, the potential cost savings would be huge if the co-metabolic natural attenuation was definitively identified and quantified. The testing is identical to that of TCE for co-metabolic degradation, with the exception that Dr. Friedman spikes the labeled 14C labeled 14D into the serum bottles. At site 3, the qPCR data shows the presence of some functional genes known to be capable of degrading 14D. These results come out well in advance of the 14C assays. So we usually get those in a week or two from MI, but the 14C assays, take at least 6 weeks of incubation plus data analysis. So we get them quite a bit in advance. And when we saw these, functional gene analysis, we were a bit optimistic. And then we got the 14C data. We saw that one of the studies had some degradation that was statistically exceeded the filter sterilized groundwater. That's the background stuff I was talking about earlier. But that's up in the top row up here. But it didn't exceed it by enough to be statistically significant. So it was close, but no luck. But we're not calling it a failed, small just yet. Dr. Friedman has explained that sometimes it just takes a little longer to drive statistically significant rates, and he's had that happen at a few sites. So he plans on resampling in a couple of months. Site 4 is the same story as site 3. Some functional genes, but really no statistical evidence of degradation was quantified. And we even had the same occurrence here where there were degradations quantified greater than the background, but it wasn't statistically significant. So we couldn't claim that it was actually occurring. So I hate to end on what's looking like a couple of small fail smalls, but we remember earlier on we had some succeed bigs, so they balance each other out and overall provide great value to clients that are happy to use these tools. But if you have any questions, I'm happy to answer them after Dora does the polling, or you can send me an email or contact me through LinkedIn. My phone number is also there too. And thank you.
Thank you very much, Matt. All right, everyone, thank you very much for sticking through the webinar. We do have the poll, as Matt mentioned, that we're going to do, and this is kind of new, so we'll try this out. So I am going to launch this poll. So you should see on your screen a question that you can answer. So if you guys can go in and select this, what are the primary contaminants of concern that you're facing at your sites? So we can see those as they're happening in action right now. And after the numbers sustain for just a second, then I'll go ahead and close that poll. So if you can go ahead and input your answers, please. All right, so I've closed the poll. I'm going to share the results here with you. It looks like the majority, about 80% of sites, are chlorinated solvents. We have a good portion of petroleum hydrocarbons, some heavy metals, 1,4-D, and PFAS. All right, so let's go to our next question here. Is proving contaminant degradation important to you? So Matt was talking about some of the different pathways. So are you interested primarily in looking at biotic, abiotic, or both pathways, something that are of importance to you? I'll give it a couple more seconds here. Okay, so the results for this poll are predominantly both pathways, which is good. And I think Matt and I are probably both excited to hear that people are starting to look more and taking all of the different components into account. I think these 14C assays are a really great way to be able to do that. All right, so one final question, and then we'll get in with Matt, the questions that you have. Can you tell us a little bit about the molecular tools that you are interested in learning more about? This kind of helps us to do better jobs of our future webinars, talking to you about what's available. So we'll give it just a minute to do the results here. All right, so I'm going to go ahead and close this poll now and share the results with you. Looks like it's pretty kind of consistent across the board that people are interested in learning more about the qPCR type of analysis called the quantarray, stable isotope probing, CSIA, next generation sequencing, and petroleum forensics. So pretty across the board. So if you have specific questions about that, you can always reach out to us. And Matt has used all of these tools as well. So he would be a good hands-on advocate for practical use of these tools in the field and can really provide you with some great insight on that. Okay, so let's go ahead and get back to your screen, Matt, and we do have quite a few questions that were entered for you. So the first one is, if it's hexavalent chromium was a product of ISCO, wouldn't it also be a product of natural attenuation but in smaller concentrations?
I don't think so, because we didn't see any hexavalent chromium in our baseline groundwater samples. So I'm thinking that there's probably the ISCO amendment that we use was permanganate, and manganese oxides are known to oxidize trivalent chromium to hexavalent chromium. So I suspect that that's the mechanism.
Okay. So this question is, since 14C is heavier than 13 or 12C and 12C is more degradable than 13, do we worry that the bond breakage is what they're concerned about and that the assay might underestimate the biodegradation rates?
Good point. I'm not exactly sure if it makes a difference. So worst case scenario is your bias low. And that's really a place that I don't mind being when I'm, arguing these, or not arguing, or presenting this information to regulators that, that we're very conservative running these. Dr. Friedman is very conservative to make sure that everything is statistically significant. And if there is a little bit more of a slower reactivity of the 14C, then then oh well, it's a little bit low. But I wouldn't think that reactivity extends across all the mechanisms equally. Like some of the, maybe for abiotic, but for some of the co-metabolic enzymes, those don't even leave an isotopic signature when they've been degraded. There's such an energetic reaction that there is no difference between C12 and C13 reactivity.
All right, this question is the 14C assay commercially available? And I'll answer that, and then Matt, you can maybe add some additional to it, is that we do offer it through Microbial Insights, but it is performed at the university lab, so it's not something that we do in-house. Anything that you think we should add there?
Just that it's a longer, so university labs, you're performing the test, so that takes a little bit longer, and you have to deal with their schedules a little bit more. Like there's not many people around in the summers or holidays, and so it takes a little bit longer. The test itself, and maybe even crunching some of the numbers, but it's well worth it. Plan in advance. I've found that working with Dr. Friedman through Microbial Insights has been pretty flawless. They're both very easy to work with, and surprisingly cost-effective tool when you consider the home runs, the succeed big's potential for using that academic laboratory.
Yeah, I think the biggest drawback is the time. We don't have a lot of control over the time on these studies. It does take a good bit of time to run these in the lab on the bench scale. So you just have to account for that in your planning. But we can be, really upfront with you on what the time is expected to be, and talk to Dr. Friedman to make sure what his schedule is going to be, so that you'll know realistically what to expect on that. Okay, next question for you, Matt, is on case study 2. Did you do any molecular tools to check for anaerobic dechlorination of DCE?
So yeah, so the anaerobic, so the abiotic can happen either oxidatively, or it can happen in higher DO and lower no DO conditions, but it's reductive. And that was the mechanism that we found to be active. But we did do some, I think you're probably talking about, do we look at hydrogenolysis? And yes, so there's no DHC present, no functional genes. There were a few of other microbes that are known to degrade the heavier chlorinatids like TCE to DCE present. But most importantly, we had no accumulation of vinyl chloride and no accumulation of ethene. So if you have, in the CSIA, showed that we had definitive evidence that TCE and DCE were both degraded. The DCE was also degraded, not just TCE to DCE, but DCE was degrading, but it wasn't along the hydrogenolysis pathway. So that's what caused us to start look for pathways that don't produce vinyl chloride and ethene. And that first got my attention at that Battelle conference, that Dr. Friedman can help us look at, basically, if it's a reaction that produces carbon dioxide, he can quantify it.
All right. Can you talk a little bit about the path forward for sites 3 and 4 as well?
Yeah, I think 3 and 4, keep the fingers crossed, but I'm not expecting anything. Maybe there'll be another round of data collection that shows something. But I think I haven't checked in with the project team exactly here, but I think we're looking more conventional, probably more pump and treat type remedies there. The concentrations here are not good enough to do biodegradation or stimulate biodegradation of the 1,4-D, and the area is too big to go cometabolic. So it's looking more like a mechanical system.
Have you seen any regulatory issues, Matt, with acceptance, given that this is happening at a university? Like any concerns with the QA/QC or data validation from the regulatory agencies?
So the biggest challenge with regulators is they hadn't heard of these pathways, right? So and I think we can all relate to that, right? TCE is degraded along the hydrogenolysis pathway is what was drilled into us for many years. It's only fairly recently, the past 5-6 years, maybe a little bit more than that, that we realize there's other mechanisms that might be active naturally. So it's really informing them and showing them some EPA documents, and EPA has some nice publications on these pathways. And the researchers that have identified these pathways forever, like Dr. Friedman's a great example. I mean, he was a student of Gossett, and he was the one who identified Gossett and Friedman, that the complete degradation of TCE through ethene, and he used these C14 assays or variants of them to prove that they were getting degradation through to ethene. So the same people have been publishing on these for years. The EPA's adopted it. The EPA has cited some of these. So it's just an education. So you just sit down, talk to them, and teach them a little bit. And when they ask their good questions, it causes you to go back and dig into the literature, call Dora, and figure out what's going on. So we haven't had any showstoppers. We have some regulators that are more resistant to MBTs than others. They're not as interested in learning, but I think the vast majority are really interested in learning and doing what's best for the site to clean it up and if they see that you're not just saying, hey, I'm pulling a literature value for degradation rate, who the hell knows if it's going to work. They appreciate that you're taking a deeper dive into it and putting some thought behind it. So all's been good so far on the regulatory front.
So have you seen any issues with lower concentration limits, like where maybe a plume was too dilute to be able to use these assays to estimate rates, particularly for vinyl chloride?
All right, so I don't know if Dr. Friedman has done anything with vinyl chloride for rates. So he spikes in the C14 contaminant. So for a vinyl chloride study, that is known to go aerobically, right? That can be an aerobic degradation process too that ends up in carbon dioxide. So it's theoretically possible to quantify those rates. And he's starting with a higher concentration, so it might be artificially induced, but the rates will still hold. It's just a higher concentration. The rates is still the same. So yeah, so I don't worry about those. And even in some of these, like I think we had everything in that first case study, everything was under 100 ppb naturally occurring, and he spiked in more because he needs to, because he needs to get that C14 into the system.
Okay. In one of the studies, you identified biotite as the reason for your abiotic degradation. Do you know about muscovite as it is reactive?
I would have to look it up, but I think I remember seeing it. And the relative rates of reactivity, I'm not quite sure about. And actually, it's even some magnetic susceptibility stuff. As I was going through and preparing this, I'm looking at most of the magnetic susceptibility data, and that's all referencing back to magnetite. And I'm not sure it's applicable to other other iron-bearing minerals that they might not have the same intrinsic magnetic susceptibility. So I need to do a deeper dive into the quantifying the reactivity and just how reactive. But I'm pretty sure there's studies out there that indicate there's several out there that I think the Biopic has a list of a few. John Wilson had a publication a few years ago that listed a few. So they're out there. So if you just Google reduced iron minerals or ferrous iron minerals, and TCE degradation, you'll come up with a laundry list of articles. And if you can scan those through and see what minerals they used, you'll probably be able to answer that one.
All right. One last question, Matt. When you were looking, did you monitor for copper in the groundwater at all, since that can be inhibitory to the MMO process?
Nope. So we were, we're doing this in a fail small, succeed big manner. So the first thing I'm worried about is I'm not trying to engineer a pathway either. I'm just saying, is this happening naturally? So I did not look to see if what the levels of copper were. We went straight to looking to see, is it happening by using that, is the TCE being degraded to carbon dioxide? What's the accumulation of carbon dioxide? But I mean, that's not a bad idea. Maybe I'll try that next time before we get out there, if I can find some literature values on inhibitory concentrations of copper.
All right, that's great. Well, thank you so much, Matt, for the amazing webinar. As always, I think you have a really interesting perspective and a really smart approach in dealing with using these tools at the site. So I always enjoy working with you. And thank you, everyone, for taking time to join us. I know everyone's busy during this time, so we appreciate you joining into the webinar. If you have additional questions that you think of, always feel free to reach out to Matt. He's an incredible resource and has a lot of experience. And his email address is listed there on the screen. If you have other questions, you can also email us at info@microbe.com, and we'll be happy to get with Matt and get responses for you. We will have the recording of this webinar that'll be available on the Microbial Insights website within the next week or two. You're also going to get a survey that comes out that talks about the webinar that we did today and other webinars that we've done. If you can give us feedback, I'd really appreciate it. We're just trying to make sure that we maximize the value for you guys and your time on these webinars. So again, thank you so much, Matt. You're amazing. I love working with you, and I'm so grateful to have you here on the webinar series today.
Okay. Thank you, Dora. I appreciate the opportunity, and thank everyone for listening.
All right. Thank you, everyone. Everyone have a great day.